With respect to the SGR, the current state of affairs you obviously are very informed about. Congress has intervened 12 times since 2002 to stop cuts being produced by the SGR, and 5 bills alone were passed in the year 2010. The scheduled cut for 2012, as you heard just a few minutes ago, is somewhere in the neighborhood of 27 to 28%. Despite our calls for a permanent solution right now, Congress has been reluctant to come up with financing for the ever-increasing price tag for full repeal. There is no clear consensus now on what payment system will replace the SGR. Our broad strategic outline, as we began the process, agreed last year to provide a short-term period of stability, and I would accentuate the word stability because this is the thing that afflicted so many physicians' practices throughout the country. And we asked for a 1-year reprieve to avoid repetition of our horrible 2010 experience. We got this last December. There were naysayers out there that said, you're not going to get it, but we got it. And I think that speaks a lot for where we are and what we were able to accomplish. Now we want to ask the new Congress for a longer-term period of stability while physicians lead the effort to develop new payment models for the future. We're going to tell them how to manage this.
But we need you all to keep up the pressure, and I'm talking about really turning up the heat.
10 times, 12 times, the Congress has looked into the abyss of a big payment cut for doctors and stepped back from that chasm. Once, towards the beginning of the decade, they let the cut go through. Medicare practices have notoriously thin margins. I don't know what the breaking point is, whether it's a 5.4% reduction or a 5.8% reduction or an 8% reduction. But it is certain that a 27% reduction would force many physicians not to take Medicare patients. Medicare is the linchpin of health system reform. If Medicare fails, all of health reform goes down. I don't think the Congress is going to do that.